Touche, and good evening, everyone. This is Jon Lascher from Partners in Health, Sierra Leone. Today is Thursday, April 30th. There were 8 new confirmed coronavirus cases today in Sierra Leone, bringing the total number of cases up to 124 in the country. Today on the audio update, I'm joined with Douglas Miller, who is our infrastructure manager. Doug is normally in Kono, although he has been splitting his time between Kono and Freetown over the last 6 months or so. But now he's based in Freetown, helping RSLAF, the military, and MSF get a community care center for asymptomatic and mild cases of coronavirus built. So, Doug, thank you for joining us on the audio update. Can you talk a little bit about the current projects you're working on?
Yeah, thank you, John. Happy to be here. Yeah, the current projects we have going on right now as related to COVID-19. So as you just mentioned, we're working on getting a CCC, Community Care Center, in Hastings, set up with RSLAF and also with support from MSF. So Partners in Health, our scope of work is mostly controlled to the site work. So we had a lot of site leveling. It's a very steep hilled site. So trying to provide some flat surfaces where we can install concrete slabs and get triage, donning and doffing areas, patient kind of outdoor recreation areas where the patients can, as you mentioned, these are the patients that are going to be either asymptomatic or in pretty good health. So we want to be able to provide an outdoor space for them to kind of sit outside and not just be stuck in bed all day. So we're working towards that, as well as a perimeter fence around the entire clinical part of the facility. Should hopefully be completing that one in the next 2 to 3 days.
Can you talk a little bit about what actually is going to happen inside this community care center and how big it's going to be?
Yeah, absolutely. So it's right now the community care center is made up of 6 existing buildings. So these buildings are being used or have in the past been used at the Peace Mission Training Center for soldiers that are going through training for the UN ops or the UN peacekeeping missions. So we're taking over the 6 female soldier barracks and converting them into what will be patient wards. So from the 6 buildings, we'll get a total of 120 beds. We're going to separate those into 2 different areas. So we'll have 4 buildings dedicated to patients as they come in. And then as you progress through the recovery, they're going to dedicate the last 2 buildings to patients that are just about to be discharged. So the ones that are in really good health or have had 1 negative test so far and just kind of waiting to be sent home and to be approved for that.
So these community care centers are being constructed specifically because there's not enough bed space for all of the patients who are testing positive but are not seriously ill. So it's 120 beds, but most of the people who are going to be here are not very sick. Is that your understanding?
Yeah, exactly. Either maybe showing very mild symptoms or no symptoms at all. But part of the Sierra Leone government's initiative is to not have anyone that is positive with coronavirus be at home. So this will be a facility for those types of patients.
And when will it open?
Well, our work should be done Sunday of this week, so in 3 days. MSF, I believe their work is planned to be completed by the end of next week, hopefully around Friday. Then the government is going to bring in the staff that will be providing care at these facilities and going through different trainings, as well as procuring and setting up the beds, tents like that. So I think the goal is within 2 weeks from today to have this place up and running and seeing patients.
During the Ebola outbreak, we also had community care centers. Is this structure designed based on any of the Ebola work that happened, or is it completely reworked for COVID?
I think it's taking a little bit of both. So some lessons learned and best practices from the Ebola times, as well as implementing maybe some new strategies for coronavirus specifically. So, for instance, we're going to be, building a perimeter fence surrounding the entire clinical portion of the campus, but we're also going to be, building a secondary fence that will differentiate between the clinical areas and the non-clinical areas, as far as when the PPE is required. So we are going to have points where the clinicians or the clinical staff will be able to check in on the patients without having to go into the full PPE area. And I think a lot of that is lessons learned from Ebola.
Can you talk a little bit about other infrastructure projects that your team has had to take on because of COVID?
Yeah, absolutely. So right now in Kona, we're also working to do some modifications to the existing isolation ward on campus. So the big things that we're doing to make this into a more COVID-friendly place are to open up the building a little bit more. So to add doorways into kind of the ends of the corridors that provide access into the patient rooms. So that'll allow us to have more of a better patient and staff flow. It'll also allow us, especially through the addition of hard physical barriers between spaces, to provide a really good separation between the green zones and the red zones, so we don't get any kind of contamination into what are supposed to be the safe areas. We're also going to be adding a perimeter fence around the building to separate it from the rest of the hospital campus. And then also we're right now kind of in the conceptual stages of performing or doing some work at a technical university in Kono, in the Kono district, to provide the Kono district's CCC. So I think we're still kind of in the beginning stages of working with the DHMT to kind of gain permission from the owners of that property to officially use it and designate it as the Kono CCC, but also try and figure out exactly what scope of work is needed to make this a safe place for the staff and for the patients.
And how's the infrastructure team doing? Are they still able to work on some of the commitments we've made before coronavirus, and generally how are they holding up?
Yeah, I think everyone's holding up pretty well. I think, when we went through the initial 3-day lockdown, we had to put, kind of pump the brakes on a lot of the work that we had going on, especially because we didn't really know what was going to happen after the 3-day lockdown. Was it going to be extended? I know there are a lot of people thinking that it would be pushed to a 2-week lockdown. So we did have to suspend a little bit of work, most of which has picked back up, which is nice. We do have some projects going on that never stopped, like the work at KGH for the special baby care unit that we're trying to open up for at the maternity ward. So we have a contractor that was able to to keep pushing through on that one. Yeah, I think there's definitely concerns amongst the team members, and I think you see this across PIH. People that have concerns or their family members have concerns about them being staff that are working full time at a hospital, and obviously hospitals at this point are one of the more suspect or dangerous, or not, maybe not dangerous, but the more one of the places that you're more likely to contract coronavirus, because that is where sick people go to seek care. So we have had some staff members that have voiced concerns about being full time in a hospital still, and their family members have also voiced concerns. But I think it's just we just have to follow the practices that our wonderful clinical team has put in place to keep everyone as safe as possible. But we still have to be there every day, and still have to keep the generators running and the water flowing for the patients.
What's keeping you motivated?
Yeah, definitely the people of Sierra Leone, and staying with them throughout this difficult time. I know we were given the option as expats to leave through like an optional evacuation. For me, it's, we're PIH, and as our kind of tagline goes, we stay. And when the times get tough, we don't flee, we don't run back home, but we stay to make sure that our jobs continue and the work continues, and the people that need the healthcare are still able to receive healthcare. So for me, it's just been about keeping through with the mission that we set out to do.
Thanks, Doug, and thanks to the whole infrastructure team.
Yeah, thank you, John, and yeah, keep doing what you're doing. Everyone really likes the audio updates, and it's a great way to stay involved with different teams, especially as we're kind of forced into staying a bit more isolated. So a nice way to kind of hear what everyone else is up to without having to come within droplet distance.
Well, we'll keep making them. Thanks, Doug.
Yeah, you're welcome.